On now to this great day of sports ahead of us, and for that we're going to be meeting Dr. James Stefanski. He is one of the first in the nation to use some new technology to help treat knee pain. Here's a little more about it. Dr. James Stefanski is an orthopedic surgeon at Cincy who is now part of a team there offering high-tech assistance to help repair and replace knee joints. His team now using a number of things to help you feel better and reduce long-term recovery, including this Mako robotic arm-assisted technology. Now, this is video provided by the Stryker website, and here's a bit more about what Dr. Stefanski does and how this robot works.
I have an emphasis on incorporation of technology and new up-and-coming procedures. One thing that I have extensive training in is cartilage restoration procedures, cartilage transplants, meniscus transplants, and then also for the folks who aren't able to be salvaged, I offer robotic knee replacements for a level of precision that's unmatched by the standard human hand. The robot can analyze in the surgery the tension on all your ligaments, and having a well-balanced knee, meaning not too tight, not too loose, is really what leads people to be happy and satisfied with their outcome long term. So by being able to measure the tension on the ligaments, we can adjust our cuts to a fraction of a millimeter on the bone and adjust our position of our components within a fraction of a millimeter to get everything just perfectly balanced for optimal outcomes long term.
So that's pretty impressive stuff. Joining us now, Dr. James, is it Stefanski or Stefanski?
Stefanski.
Stefanski. Okay, I want to make sure I get that right. He's an orthopedic surgeon with Cincy. They are now partnering with Wellington. Good morning to you.
Good morning.
So we just wanted to pick your brain a little bit because it's a really important day, football day. We happen to have the Super Bowl live on Local 12 tonight at 6:30 p.m. And we're just wondering, like we've heard in this pandemic, just because of training alterations and all that, you guys have had a number of knee injuries and things like that.
Yeah, so there's a lot of people coming back after a long time not being in the gyms, not being out in the fields, and social distancing, quarantining. People have been out of shape, and they're trying to get back to doing too much too fast and having injuries, especially with sports season coming around or finishing up rather. I helped out with high school football coverage, and we saw ligament injuries and meniscus tears, and we're trying to keep people on their feet and keep their knees going.
Yeah, we have a little bit of video. I think you do some of the Connor team, as I recall.
Right.
Yeah, and so I know it's different with high school compared to professional things in that. And I've been asked this. It sounds like a basic question to you, but I know as we're watching the game today, we think of why is the knee so vulnerable? Is it just because it carries 3/4 of our weight, or what's the?
Well, so people think of the knee like a hinge, but it's a little bit more complex than that. It has rotational components. It has to glide forward and backward as it goes. It has a screw-home mechanism where it actually has to rotate as you come into extension, and it's very difficult to balance that. It's not just a hinge where you have one fulcrum or one area where it's pivoting. It's a very dynamic process with ligaments on the side and running in between the ACL and the PCL, and then to top it off, all the muscle attachments attached below the knee that are pulling from up above to try and balance your strength and to support those ligaments.
I think it is so interesting because whenever we do stories on them, I mean, the phones just blow up. I know, there's no shortage of people that need to see you. And so when we see athletes and the ways they get hit and, the knees take so much impact, I know you've gotten better at sort of the repair and the replace process. And one of the things we saw in that story is you do sort of some robotic stuff. So tell me a little bit about that. Is that your passion?
Oh, I love robotics. I love technology. Ask anybody I know, anybody who knows me. So, yeah, the robotics have come into play really into the forefront in the last couple of years. The technology's been around for 20 years or so, but they're really starting to, they've just recently developed, total knee replacements, but we've been using it for partials before that even. But it allows you a high level of precision, and as we mentioned earlier, that is unmatched by the human hand, where you can, it's really all about executing the plan of what you're going for.
So when we were with the St. Elizabeth team, which is also part of your Cincy team, we did take a little video there because they said they actually can kind of map ahead now. So it seems like a lot of the success is in you actually being able to kind of know everything intimately about my knee, and you have newer technology now that allows you to do that.
Well, yeah, that's exactly right. So we start out with a CAT scan of the knee, which allows us to make a 3D reconstruction so we can see exactly size the implants that we're going to put, position them, and so there's a good video of it right there. We can know exactly what size and place we're going to put them, and then we can make adjustments to within a fraction of a millimeter during surgery based on how your ligaments are. So we can actually measure and get real-time feedback, with more precision and with more accuracy than could be done just by a kind of, it feels right.
Right. Or the patient doesn't know until they're finished. And,
Right.
I know a lot of you guys specialize in having to redo from when we didn't have all this. So it's nice to see that sort of come ahead of us. So I guess, in conclusion, the thing is we're moving, as you say, to sort of the end of the season, and we all celebrate football at the end of the season today. What is it that in the off season makes such a difference that you don't see those? Because often we think about it as the training time, but it's really all year, is it not?
Well, yeah, so we actually see, people coming out of the season saying, my knee has been killing me the whole season, I'm pushing through, and now we got to do something. Now we got to address this pain over here, and we're finding, you've been playing with a little meniscus tear, or you got a little cartilage ding, or you've got an MCL sprain that you just haven't rehabbed or let it heal properly. So yeah, especially in the off season, and once the season ends, that's when we're seeing a lot of things too.
Yeah. So, and that's a good time to do it. You have that recovery time. All right. So I know your team has predicted that our favorite Joe Burrow is going to be back, and you guys can repair knees like that and have them back. So we hope that's all true. Dr. Stefanski, thank you so much for just sharing your expertise with us. I know you're kind of newer to the OrthoCincy team, and we love having you around.
Thank you for having me.
Yeah, thanks for being here today.